All right, guys, so we are moving on to medical records. This is chapter 9 in your book. Again, this one is also sort of a short chapter, but still there are important aspects to this chapter that I think that you need to either recap on or learn about. So we're going to list several purposes of a medical record, compare and contrast EMR and EHR, describe at least 5 guidelines for safekeeping, and describe ownership of the medical record. So EMR is what? Do you guys remember? It's electronic medical record, and EHR is an electronic health record. So the purpose, well, number one, we want to manage the client's care. This includes initiating, diagnosing, implementing, evaluating all of the patterns of the patient's record. From beginning to end, we are managing their care. It helps provide inter or intra-office communication, so either between you and your PT, PTA, administrative assistants, or intra-office, which is to the other doctors or other people outside of the office that need to hear about it. Again, documenting that health from the day they are born until the day that they die. Everything is documented. It allows patterns to surface, which will alert any provider of needs. So if we see some pattern sort of happening that we might be able to recognize ahead of time and catch, either with high blood pressure or glucose things or depression, those are all patterns we can kind of see happening because of this records that we have. It serves as a legal bias. It is a legal document. It can be used for evidence, and then provide clinical data for education or research. So types, I know there's only 2 things on this slide. That's okay, we're going to talk about them. You have your paper records, which is exactly what it sounds like. It is written on paper. Depending on who you go to, I know some offices still do this, which is fine, or there's an electronic medical record. It's a narrow view of a patient's medical history. It is a single practice system, an EMR is. So Select Physical Therapy has an EMR system. It is just their system. It is used to communicate with just Select offices. There is also an EHR, which you might be wondering what exactly is the difference between the two. So again, the EMR is only between single practices. An EHR is a more comprehensive report of the patient's overall health, and this is designed so that it can be shared between other providers. An example of this is Pinnacle. So Pinnacle Health participants, let's say Pinnacle Health Hospital. If you go to the ER, they can document in this system, and then when I follow up with my primary care, they will be able to see that record as well. So it's 2 different offices, but the report is in the same program that I can see. Does that make sense? I hope so. The content of the medical record, gosh, this can go on for a while, but any test results, prescriptions, progress notes, demographics, correspondence, medication lists, either the history or medications that they're taking now, vaccines, and they do not resuscitate. It chronicles every interaction. So every interaction that's done is written on there. Emergency contacts, family history, medical history, social history, medications, allergies, immunizations, chief complaints, history of a present illness, physical exams. And again, those are all written. That's all contents of that medical record. We typically use a SOAP note, which is subjective, objective assessment and plan. There is a thing called a SOAPer note, SOAPER, which is subjective, objective assessment plan, education, and response. I have not seen that in my career, but it's not to say that it doesn't happen. Date, time, statement of facts, signatures are all important. For us, we still document all of the subjective information. We have objective, which is any measurements that we're taking, assessment, and plan. Assess how they're doing, and plan moving on to the next thing. What are we going to do next with our patient? So if you have a handwritten error, do you remember how to fix it? I know we've talked about this before. I know I've showed you this before. So wherever your mistake is, you would draw a single line through the error, write correction or error, sign with your initials, indicate the date, and then write the correction. If there are EMR errors electronically, typically there's a spell check, but if there's something that you still wrote in wrong, every clinic does it a little bit differently. For Select, we did an addendum. We said, hey, I didn't mean to write 20 degrees, I meant to write 25 degrees. And you would indicate where the mistake was and what date you are correcting it, and you would sign that as well. So one of our important things is protecting our electronic medical records. I know that we know we have to protect it, but actually implementing it can be a little bit more difficult sometimes. Your computer should have limited access to invalid attempts, so if someone tries to log in with a different password, it will eventually lock them out and you'll have to call the help desk. Your computer screen, I think, is the biggest problem, is leaving it up. It should lock automatically at some point, but sometimes that's only 2 or 3 minutes. And that's a lot of time for a patient to come up and look up other names. Or there's also screensavers, again, that automatic lock. But if you have a paper document, how are you going to protect that? It should still be in a folder, right? Making sure that it's face down, that you're carrying it with you, that it's in a protected area that other people can't access. A release of medical records. If a patient wants their records, they must sign a release with those specific guidelines of what they want. So it authorizes to release to another doctor, lawyer, or specific individual. Every office is different in what it says, but it must say what it wants. So if it says, I want the daily notes, then it's only going to give you the daily notes. If you want daily notes and test results, or daily notes and billing, you have to be specific in those guidelines. Mostly I've seen that the lawyers request this, but Select ended up with a specific department that actually you would forward the request to, and then they would process it, so they would bill them out then. There is starting to become a lot more electronic technology or telecommunications. Unfortunately, I don't have a ton of information on telehealth, which I know is happening a lot, or telerehab, because of the COVID-19. Right now, from when I had made this slide, you had fax, email, telemonitoring, and Skype. Fax, we know what fax is. Email, making sure that you're encrypting your email so no one can get into it or hack it. Telemonitoring is when you send a patient home with either a blood pressure machine, heart rate, blood glucose, oxygen levels. Those can all be measured and electronically taken from the machine into the doctor's computer, which is pretty fascinating. And then Skype. More doctors are doing a program like this, especially right now where it's like telerehab. I'm not sure on the specifics on what can happen with like telerehab therapy-wise. The last that I checked was that you could have, I believe it was like a visit in 7 days. So I don't know how that would work billing-wise. I know it's treated just like a regular treatment. It's just over Skype, which is pretty fascinating. So this is one interesting slide. I've had one student get sort of upset with me, but the medical record ownership, we think that we own these records, but we don't. The chart is owned by the clinic or provider or the property of the person creating them and entering data in them. So yes, it's my chart. I can have access to my chart, but I cannot just take that chart and leave. That chart is owned by the clinic. I can access the information. I can request a correction to the medical record if I wanted to, but that doesn't mean that it will happen. And then you do also need a request for record transfer to another provider. And typically what happens is they will copy your entire chart and the copies will be sent because that chart is still owned by that clinic. So that is the end of medical records. If you guys have any questions for me, again, I'm happy to answer them. Please just email me or email Professor Rohde and she could answer them for you. Thanks, guys. Bye.